This is Dr. Brett Kotlus, and today I want to talk to you about eyelid lift, or what's also termed blepharoplasty. Blepharoplasty is a surgical procedure of the upper or lower eyelid. It removes extra skin and/or fat, and it may combine some other procedures that we'll talk about later. It also tends to create a less tired appearance. There are two types of blepharoplasty or eyelid lift: the upper blepharoplasty for the upper eyelid area, and lower blepharoplasty for the lower lids. An upper blepharoplasty simply removes extra skin from the upper eyelids, as seen here. Here's the result of an upper blepharoplasty, before on the left and after on the right, and you can see she appears more alert, and the extra sagging skin that's been hanging down over her corner of her eyes has now been removed. Another example of an upper blepharoplasty removing extra upper eyelid skin and a small amount of fat to sculpt the upper eyelids and create a more youthful and more alert appearance. The upper photo here shows what upper blepharoplasty looks like at one day. There are sutures within the eyelid crease that are there for about a week, then they're removed. There's usually swelling and bruising for about 7 to 10 days, although it's not painful. And the incision fades away within that upper eyelid crease so that it's well hidden, and most people wouldn't even know that something was done. The bottom photo shows the result after 3 weeks, and the incision is nearly completely healed. Here again shows somebody 1 week after an upper blepharoplasty or eyelid lift, and you can see the incisions are slightly red after a week, and within a month they're nearly invisible. A lower blepharoplasty can be done with an incision just below the eyelash line, or in some cases an incision behind the eyelid so it is invisible. This depends on how much fat or skin needs to be removed. Here's an example of a lower blepharoplasty where the incision was done behind the eyelid, and this was combined with laser resurfacing of the lower lids to tighten the skin. She has a removal of her shadowing and her eyelid bags, and it makes her look less tired. Another example of a gentleman who had lower blepharoplasty with an incision behind the eyelid to remove the extra fat bags. Here's an example of a woman before and below after a lower blepharoplasty where the incision was done underneath the eyelash line, and this was combined with the laser resurfacing to tighten the skin. You can see the loose crepey skin has been removed, and there's less shadowing and less wrinkles. Here's an example of a non-surgical eyelid lift where laser alone was used to tighten the skin, followed by Botox to help lift the eyebrow and smooth out some of the smile lines. In some cases, a sagging brow also contributes to the heavy upper eyelid skin. In this case, extra upper eyelid skin was removed with an upper blepharoplasty, and also a brow lift was performed. In many cases, Botox, also Dysport, can improve the results of an eyelid lift. This can help eliminate the frown lines, it can help to raise the brow. Also, topical skincare, laser resurfacing, the use of sunscreen, fillers, and/or fat transfer can all be combined with an eyelid lift to make the results even better and to help maintain the results. And this is something that your doctor will talk to you about during the consultation. Insurance can sometimes cover upper blepharoplasty, but it almost never covers lower blepharoplasty. Coverage for upper blepharoplasty is when the eyelid skin is interfering with vision. Here you can see a gentleman whose skin was hanging in the way of his vision before and after an upper eyelid lift. We can determine during your consultation whether or not insurance will cover your procedure based on a visual field test that measures your peripheral vision. Photographs will be taken, and Dr. Kotlus will examine you. The procedure is done under local anesthetic. You can be either awake or mildly sedated. Sutures are in place for approximately 1 week, and then they are removed. Bruising and swelling usually lasts for about 7 to 10 days. The risks of upper eyelid lift would include a scar, bleeding, infection, dry eyes which may require eye drops, visual changes, partial or incomplete improvement of the sagging or loose skin, recurrence of sagging, and the possible need for a revision. Risks are rare, but they can happen, and you can ask more about these when you're in your consultation. Sometimes there are droopy eyelids which are repaired by another procedure called ptosis repair, and if this is an issue, then Dr. Kotlus will discuss this with you in your consultation. Dr. Kotlus is board certified in ophthalmology and fellowship trained in oculoplastic surgery, which is a specialty involving eyelid surgery, and he's performed hundreds of these procedures. You can also go to our website, eyeliftcenter.com, where we have a lot of before and after photos and more information about eyelid surgery.